Okay, so we're here with Alex. Alex, how are you doing?
I'm doing great.
Yeah? Tell us what you had done.
We're almost 2 months post stem cell. I had the stem cell on my knee.
Yeah.
And I feel fantastic. My range of motion has increased significantly.
Yeah.
So is my mobility. I even, like my Peloton bike, I even moved my seat up 3 nozzles, inches from it.
Yeah.
Because my range of motion is just so much better.
Yeah. So just to give you guys some background, so Alex, you used to play soccer in college, right? She's had a bunch of injuries to her right knee. You had how many surgeries on the right knee?
6.
She had 6 arthroscopic, open, varying procedures on her knee. She had every kind of injection in her knee. She's been doing physical therapy forever, very active, but was just in constant pain. The knee would swell, it wouldn't let her get the right range of motion. So we finally decided to do a regenerative procedure instead of going another surgical route, because you've been to like 4 or 5 orthopedic surgeons. Yeah. So even if you can see over here, she has like all the scars from her original surgeries. None of this was from anything that I did. This was just from old surgeries. We harvested some bone marrow from her back, spun it down, injected it to her right knee, and then how was your experience the same day?
Great. Like the only thing that actually hurt was the harvesting from the back.
Right.
And I went for a walk the same day. Right. The only thing again, like sleeping at night, was the pain from the back. Right. And
how long did that last?
And that's lasted like 6 hours.
6 hours. Okay,
and then the next day I rode my bike. Yeah. And then I progressively started taking more walks, and then I started getting back into biking and had no issue. Right.
So the only activity restrictions I put on her after the procedure was really just a light exercise. But pretty much she could get into a car, she could take her dog for a walk, hang out with her family. And now that you're 2 months out, you actually got the results pretty soon. Yeah. So overall, how much improvement do you feel that you've had?
Huge. I mean, I even, I joked with Aaron, I just played golf, and I was driving the ball like 200 yards, which I could never do before. And I'm moving laterally, which I couldn't do before. I was, when I moved on my right, there would be favoring. My valgus is completely gone. Yeah. You really can't even tell anymore which is the bad knee and which is the good knee.
That's good. That's good. And I think the fact that you got results so soon means that you're only going to continue to get better results. And this is super early for you to even be feeling this much better, which I'm happy about. I'm glad. Keep up doing physical therapy. Keep staying active. I think you're going to be.
I'm so glad we decided to go this
route. Good. Yeah. Me too. I mean, especially because you were considering doing another surgery. Yeah. Right. Yeah. So I'm glad we at least tried it. And then if anything ever happens in the future where you need surgical eval, it doesn't impact the ability to do that.
Exactly.
Perfect. Good. Alex, I'm glad you're doing well.
Thanks,
Anything you need to let us know.
All right.
So.